I don't have any slides, although I am having flashbacks because I teach in this room on Thursdays. So if I start talking about my midterm exam, please excuse me. But if I did have a slide, Bill, the first slide would say, I want to thank the University of Kansas for making our basketball lives a lot easier this week. I mean that. I really doubly want to thank the official who made that fifth foul call at the end of the game. But anyway, welcome to Chapel Hill. The question that I want to talk about with y'all for a few minutes is, what have we learned about the Trump administration and about efforts to repeal and replace Obamacare in this year plus that the Trump administration has been in office? And I just want to make a few observations before I hand it over to Pam and Ben. The first observation I want to make is to note just how unsettled the politics are surrounding the Affordable Care Act, how uncertain its future remains right now. And 8 years after the law was passed, that really is remarkable. I don't think there are a lot of people who thought in 2010 that we would be where we are right now in 2018 with this much uncertainty surrounding the law, with this much up for grabs in the debate for healthcare reform. And if you think about it historically, which I like to do, think back to the enactment of Medicare in 1965. It took over a decade to enact the Medicare program. Medicare was an extremely controversial idea. It was a debate that was partisan. It was a debate that was contentious. It was a debate that was ideological. But after Medicare was passed, that debate ended. It was over, by and large. And what happened with Medicare in subsequent years is the controversy receded. There were efforts, yes, to change Medicare, to reform Medicare, to strengthen Medicare, but its existence was never questioned. The issue of whether there should be a federal health insurance program for older Americans was settled in 1965. When the Affordable Care Act was passed in 2010, a lot of people thought Obamacare would follow that trajectory. Yes, it had controversial origins, but after people got the benefits, well, it would follow the same path as Medicare. And the fact that we're having this symposium today, although it's wonderful, is also remarkable that we could have a symposium where the future of healthcare as it relates to the ACA is still unclear in 2018. So that's the first point I want to make. The second point is that the ACA is not as easy a target as Republicans hoped for or envisioned. And for 8 years, the Republican Party has pledged, ever since the law was passed, to repeal and replace Obamacare. And it seemed that for a lot of those years, there was just one obstacle really sitting in their path. And unfortunately, he resided at 1600 Pennsylvania Avenue. Barack Obama, when he was president, was unlikely to sign legislation repealing Obamacare. But Republicans said, if you give us the White House, if we maintain control in Congress, we'll take care of Obamacare. We'll make good on our pledge. Well, Republicans have the White House. They have majority control, of course, of the House and the Senate, and they have not been able to make good on that pledge. It's true that at the end of 2017, they were able to repeal the penalty for people who don't obtain health insurance. But that's just one provision. The rest of the law remains intact. And the efforts in the last year plus to pass more comprehensive repeal legislation have floundered. And the question I want to take up is why? I'm a political scientist, and we, as my students know, we're masters of the obvious. So I'm going to say something obvious. That doesn't make it any less important. But an easy answer to why Republicans have not been able to succeed with more comprehensive repeal is that they don't have enough seats in the Senate. The Senate is a very difficult institution to run, and as skilled as Mitch McConnell is at leading it, it's really hard to make change happen with really narrow majorities. And if Republicans had a few more seats in the Senate, then Mitch McConnell could just tune Rand Paul out. He wouldn't have to worry about John McCain, wouldn't have to worry about any of the other Republicans who gave him trouble. And my guess is if Republicans had a few more seats in the Senate, there's a good chance that one of the repeal bills would have passed. But I don't think that easy answer is the whole answer, because after all, Republicans did have the majority that made it possible. This could have happened in the Senate, and a lot of us thought the day after Election Day in November 2016 that Republicans would succeed in doing this. And it doesn't explain why Republicans had trouble in the House, where they had a broader majority. So what else is going on here? Why else have Republican efforts fallen short? I think that a lot of the problems that Republicans have run into in trying to overturn Obamacare stems from a disconnect. There is a disconnect, in my view, from Obamacare, the myth, and the Affordable Care Act, the reality. In the Republican imagination, Obamacare is a disaster. It has unleashed death panels. It has ruined American health care. It has made health care unaffordable. And the reality is this: there are serious problems with the Affordable Care Act. The subsidies in the Affordable Care Act are not very good for people who aren't very low income. There are a lot of middle-class Americans for whom 8 years after the Affordable Care Act was passed, health insurance remains unaffordable. That's not imagination. That's true. It's also the case that the health insurance marketplaces, the exchanges, the purchasing pools that were created for the uninsured by the Affordable Care Act have not worked as well as advocates envisioned. They're not as stable. They're not as large. They haven't provided, including here in North Carolina, the scope of choice that people hoped for. So those are real problems. There are other problems that the Affordable Care Act has not cured. There's a lot that ails American medical care. Underinsurance. We talk a lot about people being uninsured. We probably don't talk enough in this country about people being underinsured. And that problem of Americans being underinsured, of not being able to pay their deductibles and their co-pays, is a problem that is worsening. And the Affordable Care Act really has not stemmed it. Nor has the Affordable Care Act cured the confusion, the complexity, the inefficiency, the very high costs that are a product in this country of having a multi-payer system of private health insurance. The Affordable Care Act didn't cure any of that. It just built on top of that. So it's absolutely true that the Affordable Care Act has a lot of problems. On the other hand, the Affordable Care Act has delivered a lot of benefits, and this is where part of the disconnect comes. 20 million Americans have gained insurance coverage since the Affordable Care Act went into effect. There are changes in how people get health insurance that we now take for granted that were created by the Affordable Care Act. Those with pre-existing conditions cannot be discriminated against by insurance companies anymore. They can't be denied coverage. And that is a revolution in American health insurance that is now part of the fabric of who we are. It used to be that insurers would have large lists of what they call declinable medical conditions. And if you were buying insurance on the individual market and you had one of those conditions, that was it. It's not true anymore. The Affordable Care Act has ended gender discrimination in health insurance and setting premiums. It has made health insurance more secure for those who do have coverage by ending a lot of the limits on policies that insurance companies have, and many more. So the point is that the Affordable Care Act, whatever its problems, and the problems are real, has also created real benefits. And that has changed the politics of healthcare in this country. What the Republican Party has discovered is you can't roll the clock back to 2009 so easily, because now you have millions, tens of millions of Americans who are beneficiaries of the Affordable Care Act. And they represent a new constituency in healthcare. And that new constituency in healthcare means that the equation of how you change policies in this country is not the same. The third thing that Republicans have learned is that repeal is really hard without viable replace. And one of the things that Republicans have struggled with in the last year plus, they can't agree on a viable replace plan. They can't agree partly because it's not a homogenous party and there are different views in the party on what a replace plan should look like. But there's another problem they've had in coming up with a viable replace plan, and that is if you look at all the variations of Republican plans that went before Congress last year, they had one thing in common, and that is they would have left many millions more of Americans without health insurance. Republican core commitments, politically, philosophically, are to lower taxes, to less regulation, to less redistribution, to less spending on social programs that redistribute. And if those are your core commitments, it's really hard to come up with a viable replacement plan. And as a result, they offered up plans that just didn't look very good compared to the Affordable Care Act. And so having identified lots of problems with the Affordable Care Act, some of them imaginary, many of them real, Republicans have offered plans that incredibly would make all of those problems worse, would make healthcare less affordable, would mean fewer people had coverage and more people were both uninsured and underinsured, and then to boot go after Medicaid, which Pam is going to talk a little bit about. Republicans did something that seemed impossible. They made Obamacare popular. If the Obama administration had known that the only thing you needed to do was to make the Affordable Care Act popular was threaten to repeal it, Barack Obama could have said he would repeal his own law. And the Affordable Care Act is incredibly popular now. And I always call this is, to me, it's like a TV show that is a critic's favorite. And they announced the TV show is going to be canceled, and people start watching it after it's. So a lot of Americans said, well, you know, we've seen Obamacare, we've seen that miniseries, we don't like it, but well, don't cancel it, we're not done yet. And so one of the major legacies of Republican repeal efforts is that the Affordable Care Act now is more popular than it ever has been. Go figure. Fourth point that we've learned, legislation is not the only way to attack the Affordable Care Act. And the Trump administration is committed to blowing up the insurance marketplaces. They have taken a number of actions, from eliminating the cost-sharing payments that insurers get to reducing the amount of money put into advertising for open enrollment, to reducing the amount of time the website healthcare.gov is available for open enrollment, to moving towards legalizing short-term insurance plans, to supporting the action in Congress to get rid of the penalty for not having health insurance, all of which are designed to destabilize the insurance marketplace. This is no secret. It's no great revelation. It is remarkable how committed they are to that strategy. They don't want the ACA to work. They don't want the marketplaces to work. And what they're trying to do through public policy right now is create a self-fulfilling prophecy, where through policy they destabilize the marketplaces, and then they say, look, we told you Obamacare was a failure. That, when you take a step back, that's a sort of remarkable stance to have in healthcare policy, but it is absolutely the policy of this administration and to a large extent this Congress. And it speaks to a fifth point. We don't know yet what the outcome is going to be. It's too early to say what the outcome is going to be of all those efforts. There are some signs that enrollment went down modestly this year. We'll have to see next year what the result is. But that failure to produce bipartisanship in health policy, and we just had just recently this past week another effort at bipartisanship to repair the ACA and to work on the cost-sharing payments, and it did not go through in the budget. It points to a fifth point, which is maybe the most important point of all, and that is bipartisanship has proven incredibly elusive, and the politics of Obamacare are defined by partisan polarization. The way that political scientists measure it, Democrats and Republicans are more polarized in Congress right now than at any point since the 1870s, and we had just fought the Civil War. That means there's no middle. That means reform is difficult. That means that what was possible for Medicare, where Democrats and Republicans could come together in the 1970s and in the 1980s to make changes to Medicare, that is not possible in Obamacare. Obamacare is an existential fight between the two parties. And that partisan polarization has defined everything about the politics of the Affordable Care Act at the federal level and also at the state level. It is a fact, I believe, that much of the debate over Obamacare has nothing to do with the Affordable Care Act. It is instead a front and a broader war between the two parties. And that partisan polarization really defines the kind of healthcare system that we have and the kind of healthcare reform. Last point I want to make, and that is this healthcare debate is very volatile. I said before that not a lot of people would have predicted in 2010 that we'd be here in 2018. For every action, there is a reaction. And the threat to repeal Obamacare, while it didn't go through, has left another legacy. and that is it has emboldened the movement for Medicare for all in this country. And Ben's going to talk to you a little bit later about this, but I think there's a very good chance that in 2020, the Democratic nominee for president is going to be in favor either of Medicare for all or Medicare for more. And that is a shift left, a dramatic shift left in the thinking of the Democratic Party on healthcare reform. It is a product of this polarized debate where Congress going to the right has now moved the Democratic Party to the left. And I think we're in a very, very volatile time in healthcare politics, and who knows where we're going to be in 2019, 2020, and especially 2021. And so here we are 8 years after the Affordable Care Act was passed, and we have no idea where we're going. Good news is we've got Pam and Ben up next to tell us. Thank you very much.